Hey guys, I'm Joanne Johnson, Executive Director for the Oconee County Chamber of Commerce, and this is another episode of What's the Buzz? Welcome everybody, we're glad to have you. Today, I am joined by Tim Groves, who is the owner, or one of the owners rather, of AFC Urgent Care, and Dr. Jeffrey Harris. He is the medical director for not only the AFC Urgent Care in the Seneca Clemson area, but also, as you'll learn, they've got other endeavors and other clinics, and we'll be talking with them in just one second to go over all of that. Gentlemen, welcome. I'm so happy to have you.
Great to be here.
Yeah, thank you for having us.
Absolutely. Now, we met just briefly last week. You guys had the most outstanding ribbon cutting, and I loved this because all of you had your masks on. It was a hot day, but it was a beautiful day, and you guys were showcasing the most state-of-the-art urgent care I think that our area has seen to date. Tim, can you talk a little bit about how this got started? And then Dr. Harris, we'll move to you in just a second, but I kind of want to go over the background and how you guys ended up with the urgent care here.
Well, my wife and I actually started, I think we have some echo going on there. Better? My wife and I started the first AFC Urgent Care, which is a franchise. We bought the first franchise for the Greenville area back in 2009, opened it in 2010 on Woodruff Road in Greenville. We ended up opening two more ourselves, and another franchisee opened one, and then in 2015, we sold all those to Bon Secours, and then we operated them for Bon Secours for a while and helped them develop some others. And then right about that time, we formed a partnership with Dr. Harris and some of our other partners, and we decided to develop outside of Greenville County because Bon Secours wanted to develop all they could in Greenville County. So that's kind of how it's played out. So we opened our first one outside of Greenville County in Easley in 2016, then Powdersville, then Boiling Springs, Greenwood, Duncan, then Anderson last November, and we've been looking for all this time to open one in Clemson. We've been really working on trying to find a Clemson Seneca site for 4 years now. And we had several different locations we looked at, kind of on the main road there, but then when but we couldn't quite find the right fit. And we typically like to own the real estate and build out our own. So develop shopping centers or rehabilitate a shopping center or something like that. Couldn't find the right fit there. And then we found the location in Hartwell Village and started about a little over a year ago, negotiating with them for the lease, and then doing everything it takes from that point on to build it, get it open, get it staffed, get all the equipment in, supplies, etc. So this one we opened in Seneca, Clemson last week is the 14th AFC in the upstate. And Bon Secours is still developing them. They're opening one on Haywood Road in Greenville this month. So so we have the biggest presence of any urgent care in the upstate. And we work very closely with Bon Secours on a lot of different things, and you know, we have a good collaboration with them.
What is it, do you think, that draws people to the AFC urgent cares over anybody else?
Well, one of the things that we've always focused on from day one is providing great customer service in addition to great medical service. So it's been part of our operating philosophy, our hiring philosophy. The people that we hire, not only do they have to have good medical credentials, be certified in their area of specialty, which most of our staff is. We have, you know, of course, physicians and nurse practitioners and x-ray technologists and medical assistants, and then also receptionists. And most of those folks have to be trained and licensed in their particular area of expertise. So we know they're qualified in that when we hire them or when we're interviewing, but we also look for personality, someone that has a warm customer service personality, because you can't teach that. If someone's a grumpy person, it's hard to train them not to be a grumpy person. So so we really focus on that, and then we monitor it all the time. We actively solicit feedback from our patients about not only their medical service, but their customer service, from, you know, the greeting when they arrive and how they're treated throughout the stay. and we share all that feedback with our staff on it literally twice a week. And we have another system that actually is ongoing, where the providers can go in and see what people are saying about the service, and our managers can as well. So we really focus on that feedback loop to make sure we're doing everything that makes the patients happy from both a medical and a customer service standpoint.
And I have to say, and that was evident at even just the ribbon cutting. It's a beautiful facility. There's the state-of-the-art equipment that's in there. And Dr. Harris, I wanted to say something to you too, because you were right out there at this ribbon cutting. You were front and center, and you were greeting everybody and virtually hugging people, and doing, because we're social distancing folks, but you were out there and you were very approachable, and you and I just had this conversation. We were talking about the COVID pandemic right off the bat, and just having an authentic conversation, and that matters to people, because people can take their dollars anywhere. We have a lot of competition in every field, but what makes us stand out above and beyond, I think, Tim, to your point, is the customer service. It's, obviously, Dr. Harris, you're knowledgeable, and I want to get into that in a minute, but the customer service is everything.
Yeah, we recognize that this is retail medicine, and we work really hard to strive to be front and center, all the owners, all the leaders, the medical directors, because we recognize that. So thank you for recognizing that, and we appreciate what you're doing there also in the area.
Not everybody loves to go to the doctor, Dr. Harris. Not everybody signs up and goes running into a place like that, and there's fear. And the way you come across is, I know that you take that fear away as best you can, because you are so approachable and because you are so knowledgeable, but you're seeing people as people, not just as a number. Like, it's not just another person coming in the door. I can tell just in the brief time that I met you that you really do care about your patients.
Yeah, we strive when we hire folks to recognize that also. I mean, that is a key hiring factor for our providers. We want them to ease people's fear and be able to talk to them in a very approachable way.
Talk to me about the equipment that you've got in that facility.
Okay. Well, just to kind of reiterate what Tim was saying, as far as our X-ray equipment goes, it's all digital X-ray. We're able to get overreads from trained radiologists within 5 to 10 minutes. Most of the time we get the feedback and the readbacks before the patients leave. Now, we always encourage our providers, the ones that order the test, to actually look at the films too themselves, so that they're not just relying on the radiologist. But it is a big perk that we're getting a radiologist to overread all of our films immediately. We have a state-of-the-art procedure room, and we stock it with the equipment to be able to do pretty much any procedure that the providers feel comfortable with. Now, we do expect our providers to be able to do lacerations, abscesses, acute things like that, right? But if our providers want to remove toenails, if they want to remove moles, if they want to do minor surgery, because we do have retired surgeons that want to work urgent care that we hire, and they're a little bit more aggressive with the procedures that they like or want to do. We stock our procedure rooms with the equipment to be able to do that. They have autoclaves where we can clean equipment, so therefore we can order a little bit better equipment with the autoclaves. And it's stocked to be able to do, again, whatever procedures need to be done. We have the ability to do orthopedic procedures, right? So we have a room that's stocked with basic removable splint, walking boots, things like that. But we also have the ability to use fiberglass to make splints and correct orthopedic injuries.
That's interesting. I don't know that the other urgent cares have that, do they?
I don't know. I've not worked in another urgent care, so I can't speak to that directly, but I feel that that's what provides the best practice and best care for our communities.
I think it's wonderful. And when my daughter broke her hand, and this is before you, so she went to an urgent care, and they x-rayed it, but then she had to end up going to a totally separate facility to get it splinted and all of those things. So that is a huge benefit.
Yeah. And the other benefit we have, I think, too, is our lab. So our lab, we're COLA certified in 5 of our centers. The other centers, we don't have to be COLA certified because of the type of new technology equipment that we've put in there that doesn't require that. But we do have the ability to run a lot of labs in our facility. And coming in the near future, we're going to be able to run point of care testing, meaning rapid testing for all things important during the winter time, meaning strep, flu, as well as COVID. We'll be able to run point of care rapid testing for COVID in the next 4 to 6 weeks.
Now you're doing COVID testing.
I'm sorry, I was just going to say, we are doing COVID testing now. And Dr. Harris, you might want to explain what we currently do.
Okay. Yeah, so currently we are doing COVID testing, and we do work with a local lab. Our lab is here in Greenville, so our turnaround times on getting our results back are much quicker. So our turnaround times right now are 24 to 72 hours. But we also work with a national research company. And so with Abbott Labs right now, we are participating in a study for the machines that will be put in the offices, right? And that study kind of comes and goes. But when the study's up and going, we have it in Easley and Powdersville right now, and we are able to give rapid tests when that study's up and going. So hopefully that study is going to last long enough to get us into September, whenever we're going to be doing our own point of care testing, our rapid testing. But as of right now, we are at the mercy of the study, but we are participating in the study. And by the way, there's only 6 sites around the country that are participating in this study, and we're one of them. And I think we're the only organization on the East Coast that has participation in this study.
So, and with the COVID testing, we talked about this the other day, you're doing the testing a little bit differently. So when I went to a different facility and I had the COVID test and I felt it all the way at the top of my head for about another minute afterward, and I told you I felt like a Pez dispenser, you said, we do ours a little bit differently, and let me tell you how we do that. Can you share that with people?
Well, there's several different ways you can collect specimens, right? So there's nasopharyngeal, there's nasal, there's oral, and there's a lot of studies going on around the country right now to determine which one has the highest sensitivity and specificity. With talking with the lab that we're using, and they're participating in some of these studies too, it doesn't seem like there's a big discrepancy between doing nasopharyngeal and nasal. So the majority of testing that we're doing is nasal. So we do not have to put the swab all the way back in the nose. And so far, the studies aren't that big of a difference between the two. But those are ongoing studies. So everything that we're doing with COVID right now is best practice, and trying to keep up with the literature, and the literature is coming out. I don't think there's any specific data. We're just doing the best we can. And I feel that with what we have right now, it's all close enough that in numbers that why would we need to put people through that unless we have to? Now, we may find in the future that the nasopharyngeals have a much better sensitivity and specificity, and we may have to change to that. But right now, there doesn't appear to be that big of a difference.